Well, hello, Spring Hill. This is Mike Patronis. I'm the CEO at Spring Hill Medical Center, and I'm with Pete Johnson today, and we're going to talk to you just a little bit about our vaccination program. But first, I just wanted to let you know that everything that you're seeing in the news is probably coming real time, just like it is coming to us at real time. It was just last week that I was on a phone call with the governor's office and listening to how each region is handling the processing of getting vaccines out and distributed in the communities. And I've appointed Pete Johnson, and Pete is our chief of ancillary and also our chief pharmacist here. And he's been doing this business for over 30 years. And so Pete's going to talk to you a little bit about some of the details of how we plan on getting vaccines to you. But I just wanted to tell you up front that, number one, there's a lot of information coming from the state, even some changes coming from the federal government. You probably saw this past week where everybody's been addressing the different tiers and levels of folks that are going to get the vaccine. So we had anticipated starting with 70 and older, and then we saw the president sign off on 65 and older. But the state has not made that adjustment just yet in Louisiana, so we anticipate serving 70 and older first. You're also seeing where the state is distributing out the vaccine through some pharmacies. And so the goal is just to get vaccine in everyone's arm that we can as quick as we can. So that's our goal. The other challenge that I've asked for Pete and the team is that the day we get it is the day we distribute it. Now, in all practical purposes, depending on how much vaccine we get, it may take a couple of days to get it out there. But our goal is to, as soon as we get it, is to get it right out there to you. So I'm just going to have a little chat here with Pete and talking to you and trying to inform you of where we are in the process and what you can anticipate from your Spring Hill Medical Center team. So Pete, why don't you talk to the community a little bit and tell them about what you and the team have been talking about and how you've been going through some of that decision making, and then just some of the basics of what they can expect over the next several days and maybe next couple of weeks.
Okay, so we've placed our order with the state. We don't know when it's coming in or how much it's going to be, but as soon as we know, like we'll probably find out on a Wednesday that we're going to get it on a Monday. And when that happens, then as soon as we know that we're getting it that Monday, we're going to start taking reservations for the distribution based on how many we get. Our plan is to get a large facility, maybe like the CAC, and we're going to do a mass vaccination at one place. If we get 600 doses, my plan is we can get 600 doses out in one day. It may take us a little longer than that, but we're going to work to where we can do as many as we can at one time. The key is it's probably when we get it, depending on which vaccine we get, we probably only have it for 5 days anyway, but we don't expect us to take that long to get it out. We know that we have that many people that need it. So that's our plan. We're going to do a max vaccination, and as soon as we know the dates, we'll post it on the website. We'll send out information through everybody we can in the town, in the area, to make sure that people know to sign up. We'll be asking the community to help us. Our sign up is going to be online. We'll also have a phone number that people can call and sign up that way. It'll be quicker online because you won't have to wait for someone to answer the phone. And we're asking the community, if you have people that you can help to sign up, that would be great too. But we'll have both ways to do it. And we've got a good team. We're pretty sure that the process will work, and we're just working through it. We just need to wait until we get that notification from the state that we're going to get vaccine in. As Mike said, right now it's at 70 and over, and we will need to verify that. We're under strict guidelines from the state not to go outside the group that we're in at this point. And so we'll start with 70 and over, and if that number changes, we'll let everybody know. I'm trying to think. Let's see. Once you get there, just so everybody has this information, we have to monitor the patients for 30 minutes. That may change at this point, but right now it's 30 minutes after we give the vaccination. So we're going to ask everybody, so that we can keep social distancing, to show up just before your time, and then just know that you're going to have to stay for a little bit after that.
And Pete, that's great information, by the way. Thank you for putting us all together. And I know how hard you and the team have worked over the last couple of weeks and working with the state, working with local agencies to try and piece together the best way to go about this. But just in general, if I were a patient right now thinking about, okay, what can I anticipate? So I'm at home. If I have questions or wondering at any moment where we are in Spring Hill with vaccinations, I can check the state webpage. And then I can also check in at Spring Hill Medical Center homepage, because we're going to have information there starting today with this video and other information that people can look at and say, okay, this is where we are in our community. And then so at some point we're going to have our phone number and our website up where people can then schedule, once we have the knowledge that we have these vaccines coming in on a certain day. We'll post a schedule where people can sign up for time, say within an hour time frame, and then or however we're going to do it, and then you anticipate that someone would be able to. We publish the location, so if it is going to be the CAC building, if it's available that day, then there's enough parking there. Folks would come in within that hour time frame. We're going to make allowances for folks that are handicapped and need a little help, so we can come out to them perhaps. We're already talking about that. We're not necessarily looking for a drive-through service, because we feel like that we can handle more people in a single day if we can have them come in, park, come through the line, finish up any paperwork that we might need that hopefully folks have already registered on the website that we'll have available to them. And so they can walk through the line, get their shot, wait their 15 or 30 minutes. 30 minutes? Is it 30 minutes?
Right now it's at 30 minutes.
Right now it's at 30 minutes.
And our plan is to have 4 lines, and it doesn't take long once the paperwork's done. It's real easy. It doesn't take any time to get the actual vaccine. So that is our plan, that if we can get 4 lines going, maybe 5 lines going, we can do this very quickly and vaccinate a lot of people in a hurry.
There it is. So that's perfect. And so then once you're done, you'll get a card. Your card will tell you the date that you got that first round. And so then you'll be anticipating getting that second round 21 days later. And Pete, have we already set up how we're going to have communication with everyone? Like those 600 or 700, maybe we get in on a Wednesday or Monday, like you're saying. They come in and get their shot. How will they anticipate getting their next shot?
Well, when they sign up, we'll get email address and phone number, and we'll contact them that way. And so that will be, once again, on that second round, it doesn't have to be at 21 days, but it's going to be close. And as soon as we know that shipment's on its way, we'll contact everybody and say, okay, it's on the way. We're going to do round 2 for the first group.
So once they've entered that system, gotten that first shot, then in reality it's positive control after that, and we should be communicating out to them.
Right. They won't have to contact us. We will be in contact with them.
That's perfect. That's perfect. Well, Pete, any other thoughts on just in regard to vaccines or any other items that are going on with COVID right now?
Let me check my notes real quick just to make sure we're not leaving anything off. No, Mike, I think we've covered everything that I know of. Like I said, keep looking at, checking the website for more information. We're going to post this video plus just some bullet points that we have to answer questions. The phone number will be up soon, and if you have questions from that point, whoever answers the phone or leave a message, and we can get back to you about the vaccines. I know a number of people have had questions about, if I've had an autoimmune disease, or if I've had this, can I get the vaccine, whatever, and we can answer those questions for you. If we don't know the answer, we can look them up, but we want everyone to get this vaccine, and we want to get it out as quickly as we can, and we have vaccinated most of our staff here and have not had any issues, and I just want people to know so far this looks like a really safe thing, and the quicker we can get everybody vaccinated, the quicker we can get back to normal.
That's right. And you did mention if people have a question on whether they should get the vaccine, would you rather them call into the clinic and ask about an appointment to find out from their doctor earlier, or are we going to have staff on site so that when they come there, we'll have staff that can give them advice based on?
It'll be both ways. I mean, if you want to call your provider, that's great. That would be a way to find out. Or if people have questions that day, then we can still answer those questions. We'll definitely have plenty of people there who can answer questions. But I mean, maybe to save you a trip or from signing up, then if you have questions, then yeah, contact your
Especially if
provider.
you're a patient that has a lot of comorbidities, maybe some complex issues going on, or maybe some prior experience with prophylaxis and issues with immunizations. Maybe if multiple different physical symptoms or systems that are affected potentially, then they should probably make an appointment with their doctor ahead of time.
Yeah, right now I can say that in general, there is not anything out there that's precluding somebody from getting the vaccine other than you just got over COVID. I mean, if you just, I mean, what they're saying is 90 days from when you were first diagnosed is when you should get the vaccine, but that is the only thing right now, really, that I've found that is something that would say, all right, you don't need to get this. I mean, we've had
Gotcha.
autoimmune diseases, Guillain-Barré, anything like that. The questions that have come up to me, it's always been when I look it up, get the vaccine.
Get the vaccine. Well, and I just got the vaccine this month. I've had COVID back in September, so I was past that 90 days, experiencing no side effects. I do feel like every individual is a little bit different. This is a personal decision, but I certainly would encourage folks, I'd much rather someone get the vaccine than get COVID. And so thank you, Pete. I really appreciate the energy that you're putting into this and the professionalism that you bring to the team, but also leading our team and putting everybody in a position of success here to get us ready. And certainly if we have anything that gets bumps in the road, we'll communicate via our website so that we can get the word out to everyone. I also want to thank folks in the Spring Hill community for letting us serve you, especially during this time of COVID. I will tell you that our goal has been to leave no one behind. As we treat everyone like family, the last thing we want to happen is for someone to be at home and wonder, am I sick enough to go see the doctor? Am I sick enough to where I'm hearing of these therapeutics that might be able to help somebody? I don't feel so bad, but maybe I should make a call. I'm here to tell you that we would much rather you come see us, call us, allow us to provide you with outpatient therapeutics that are available to us now, or if we need to put you in the hospital, to allow us that opportunity to give you therapeutics in the hospital. I can tell you from just personal stories that I've had with other people, the last thing we want to do is for one of our family members to be hard-headed, to feel like, well, I really don't have bad symptoms, but I just can't breathe very well. No, if you have symptoms, even if they're minor, we want to make sure that we're treating you. So please give us that opportunity. We want no one left behind. We're trying to work with everyone in the community. That includes ambulance services, home health agencies, our urgent care center in town. All of our health-giving agencies in town are trying to work together to make sure we serve you best. But sometimes it can't start unless you come see us. So please, let's leave no one behind, and let's make sure that if you have questions about this vaccination process, that you reach out and let us know what your questions are. We're looking forward to getting that vaccine in our community and looking forward to getting that out as quick as we can. Thank you for watching this video.